Leaders with the Health Resources and Services Administration visited Centreville in Bibb County today to discuss rural maternal health. Now, this is part of the National Enhancing Maternal Health Initiative tour, and today is National Rural Health Day. ABC 3340's Valerie Bell explains why this discussion was an opportunity to listen and learn to provide the best maternal health care possible, particularly in those rural areas that present some challenges.
Federal leaders at HRSA gathered around the table with dozens of other healthcare leaders. The discussion centered around improving maternal health care, particularly in rural areas.
We are in the midst of a maternal health crisis in this country. When you look at the number of women who die every year, either during childbirth or during that first year following childbirth, when we look at the percentage of babies born low birth weight or infant mortality rates, babies who die during their first year of life.
Dr. Michael Warren says regardless of where people live, they should have access to strong prenatal care, a safe, high-quality labor and delivery, and the best chance at a healthy first year. That's why roundtables like this one are so important.
One of the things that we hear over and over at these events is the power of partnerships in communities. So we've seen, for example, when a health center sits across the table from a home visiting program, they think about opportunities to make referrals between the two.
The event was held at Cahaba Medical Care. CEO and family physician John Waits says it's important to offer affordable care in such a critical part of life.
HRSA has sponsored a lot of different family medicine OB training programs. So there's 3 or 4 different places that are training family doctors to go do advanced women's health in clinics like Cahaba Medical Care, in hospital systems in rural and urban. And it's so important to bring this sort of attention to women and children care as we see some 10 different rural labor and deliveries have closed over the last decade in Alabama. We need those labor and deliveries to stay open for our trainees to go practice there to keep communities whole in terms of taking care of women and children.
HRSA's Associate Administrator for Rural Health Policy, Tom Morris, says 59% of rural communities don't have a hospital that offers obstetric services, emphasizing the need for collaboration.
Everybody deserves access to care. And so anything we can do to sort of, whether through our programs or our policies, help communities sort of make sure that they can have a functioning rural hospital, have strong primary care, access to behavioral health services, all of those are critically important. And so I know it's important to the folks there, and it's important to us as well.
In Centreville, Valerie Bell, ABC 3340 News.
Also expecting or new mothers and their families are urged to contact the National Maternal Mental Health Hotline if they need support. You can call or text 833-TLC-MAMA 24/7 for emotional and mental health support.